Father, is it too early to attribute the vaccines, at 3.5 million fully dosed and about 9 million with their first dose? Is it too early to make a correlation between the vaccination rate or the vaccination numbers with the flattish numbers?
So let me just point something out. Last week, Bacolod recorded the introduction of new variants for the first time. And so they recorded alpha beta variants arriving in Bacolod. Now remember, what you're seeing here, and that confirms our OCTA's proposal, that what you are seeing is that you are having the initial variants in the NCR now spreading around the country. And that's what you're seeing. So the second wave. Now, it is very deceptive. So a lot of people are looking at countrywide herd immunity, and it's very deceptive to talk about, well, there have been 3 million Filipinos who are fully vaccinated in the country, because the government strategy is not an all-country equal distribution. So in the United States, it was equally distributed according to population. So they could easily talk about once you knew herd immunity, once you knew the population immunity for the country, you had a general sense. But here, properly speaking, we have to focus on the numbers in the NCR +8, because that is the region that the government is prioritizing. And so the question, Luchi, you have to ask is are the numbers in the NCR +8 reflective of the vaccination campaign? And OCTA had a conversation about this the other day on our group chat, and we would not expect that yet for the following reason. One is, what you will see once the vaccinations kick in is that the hospitalizations are going to change, so that there will be more young people going into the hospital than old people. So for the most of the pandemic, it was the old people went to the hospital, the young people did not. If you look at England now, if you look at Israel now, if you look at parts of the US, there are significant numbers of young people. That's because the elderly are protected. So when we see that, right, when we start seeing a shift where the young non-vaccinated people start to increase relative to the old, you will know that's vaccination. We don't have that yet, simply because the NCR has not had a surge, right? So the numbers are still relatively low. I mean, if we have a Delta surge, you will begin to really see the effects of the vaccination, we hope, right?